Clinical biochemistry for third semester medical students. Clinical biochemistry 1. Fundamentals of clinical biochemistry. A definition of clinical biochemistry 1. Definition of clinical biochemistry. A branch of biochemistry focused on molecular analyses in clinical laboratories to assist in disease identification, monitor treatment effectiveness, and predict patient prognosis. Clinical biochemistry bridges biochemical mechanisms in the body with the clinical manifestation of diseases. 2. Objectives of clinical biochemistry. Identify metabolic or biochemical abnormalities associated with diseases. Develop diagnostic methods that are faster, more accurate, and specific. Evaluate the overall health status of patients through biomarkers. 3. Scope of clinical biochemistry. Monitoring metabolic disorders such as diabetes, thyroid diseases, or lipid abnormalities. Assessing organ functions such as liver, kidney, and heart. Identifying nutritional deficiencies, hormonal disorders, or toxicities. B. Tools and techniques in clinical biochemistry. 1. Spectrophotometer. Working principle. Measures the intensity of light absorbed by a sample at a specific wavelength. Measurement types. Absorbance or transmittance. Examples of application. Bilirubin analysis to assess liver function. Hemoglobin measurement for anemia evaluation. 2. ELISA, enzyme-linked immunosorbent assay. Working principle. Enzymatic reactions detect antigens or antibodies using a specific substrate that produces color changes. Advantages. High sensitivity, capable of detecting low concentrations of biomolecules. Examples of application. HIV detection, measurement of hormones such as insulin or TSH. 3. HPLC, high-performance liquid chromatography. Working principle. Separates molecules based on polarity and size through a high-pressure column. Advantages. High accuracy for analyzing complex metabolites. Examples of application. Amino acid analysis. Drug detection and toxin identification. 2. Biomarkers in clinical biochemistry. A definition and role of biomarkers. 1. Definition of biomarkers. Biological molecules that can be measured to assess physiological or pathological functions of the body. Biomarkers can include enzymes, hormones, proteins, or specific metabolites. 2. Categories of biomarkers. Diagnostic. Help detect specific diseases, e.g., troponin for heart attack. Prognostic. Assess disease prognosis or progression, e.g., HbA1c for diabetes control. Predictive. Estimate response to specific treatments, e.g., genetic biomarkers in cancer therapy. B. Examples of clinical biomarkers. 1. Glucose. Importance of glucose. The body's primary energy source, with abnormally high or low levels indicating metabolic disorders. Measurement methods. Fasting blood glucose tests, HbA1c, and oral glucose tolerance tests. 2. Cholesterol and lipids. Types. Total cholesterol, LDL, bad cholesterol, HDL, good cholesterol, and triglycerides. Importance of lipid profile. Assess the risk of atherosclerosis and coronary heart disease. 3. Liver enzymes, ALT, AST, ALT. Marker of liver cell damage, more specific. AST. Found in the liver, heart, and muscles. Increased levels indicate organ damage beyond the liver. 3. Metabolic biochemistry and metabolic disorders. A carbohydrate metabolism. 1. Glycolysis. Key stages. Preparatory phase. Investment of 2-ATP. Payoff phase. Production of 4-ATP and 2-NADH. Clinical disorders. Lactic acidosis due to oxygen deficiency in tissues, hypoxia. 2. Gluconeogenesis, key enzymes. PEP carboxykinase, fructose 1,6-bisphosphatase. Clinical disorders. Severe hypoglycemia in enzymatic deficiencies of gluconeogenesis. B. Lipid metabolism. 1. Lipolysis. Process. Breakdown of triglycerides into free fatty acids and glycerol by hormone-sensitive lipase, HSL. Clinical disorders. Lipid accumulation in tissues, hepatic steatosis. 2. Cholesterol biosynthesis. Key enzyme. HMG-CoA reductase, target for statin therapy. Clinical disorders. Atherosclerosis due to high LDL levels. C. Protein and amino acid metabolism. 1. Protein synthesis. Process. From DNA, transcription, to mRNA, then translated into proteins in ribosomes. Clinical disorders. Genetic diseases like Tay-Sachs due to protein mutations. 2. Nitrogen metabolism. Stages. Deamination produces ammonia. Ammonia is converted to urea, urea cycle. Clinical disorders. Hyperammonemia in liver failure or urea cycle enzyme deficiencies. 4. Clinical biochemistry in disease diagnosis. Endocrine disorders. 1. Diabetes mellitus. Type 1. Absolute insulin deficiency. Type 2. Insulin resistance. Supporting tests. Random blood glucose. HbA1c, C-peptide, 2. Hypothyroidism. Classification. Primary, thyroid problem. Secondary, pituitary, tertiary, hypothalamus. Manifestations. Fatigue, weight gain, dry skin. B. Liver diseases. 1. Hepatitis, etiology, viral, alcohol, drugs. Additional tests, hepatitis antibodies, viral PCR. 2. Liver cirrhosis, complications, hepatic encephalopathy, portal hypertension. Assessment, MELD model for prognosis. 5. Electrolytes and acid-base balance, a electrolyte regulation. 1. Sodium, Na, balance, controlled by aldosterone and ADH hormones. Hyponatremia. Symptoms include seizures or cerebral edema. 2. Potassium, K, function, nerve impulse transmission. Disorders. Hyperkalemia leads to cardiac arrhythmias. B. Acid-base balance. 1. Blood pH. Normal range, 7.35 to 7.45. Disorders. Acidosis, pH less than 7.35. Alkalosis, pH greater than 7.45. 2. Bicarbonate, hydrogen carbonate, primary buffer, regulated by kidneys and respiratory system. 6. Clinical biochemistry testing methods. 1. Blood glucose tests, measurement frequency, daily for diabetic patients. Innovation, continuous glucose monitoring, CGM. 2. Lipid profile, risk assessment, calculation of LDL-HDL ratio. 7. Clinical pharmacology in biochemistry, a drugs and metabolism. 1. Drug interactions. 450 cypriot pounds inhibitors can prolong drug activity. 2. Drug monitoring. Example, warfarin, INR, to prevent bleeding complications. B. Nutritional therapy. 1. Metabolic disorders, low-protein diets for nitrogen metabolism disorders. 2. Obesity. Approaches such as ketogenic or low-calorie diets.